Most people are unaware that pancreatic cancer ranks among the most lethal forms of cancer today, quietly surpassing the death tolls of both breast and prostate cancer in numerous countries. What's even more alarming is how little attention it receives, despite its increasing prevalence. Imagine this for a moment. By understanding just a handful of crucial symptoms, you could potentially help yourself or someone close to you recognize this disease early, before it's too advanced. Pancreatic cancer has earned its nickname, the silent killer, for a reason. With a 5-year survival rate of around 12%, it can progress undetected, claiming more than 65,000 lives annually in the United States alone. What's truly frightening is that close to 80% of patients miss the early symptoms, often mistaking them for minor, everyday issues. By the time they seek medical help, the cancer has often reached an advanced stage. But here's the key insight. Studies now reveal that many warning signs actually begin to surface 3 to 6 months prior to diagnosis, offering a rare chance for early intervention. Though the pancreas is a small organ located deep within your abdomen, it plays a critical role in managing blood sugar and producing digestive enzymes. Because of its hidden position, tumors can develop quietly, evading early detection. That's why paying attention to even subtle symptoms is so important. In this video, we'll uncover 8 unexpected signs of pancreatic cancer, some of which are so ordinary that they're commonly ignored. Here's the game-changing discovery. According to recent scientific findings, identifying just 3 of these symptoms occurring together can increase the likelihood of catching the disease early by nearly 70%. Why does such a deadly illness remain largely unnoticed? Why aren't these facts part of everyday health conversations? If you find this information valuable, be sure to like this video and subscribe HealthBee channel for more life-saving health updates. Now, let's dive into the first crucial symptom you should be aware of. 1. Digestive difficulties. Pancreatic cancer can significantly impair your digestive system by disrupting several essential processes. The pancreas is vital for digestion. It produces enzymes that help your body break down fats, proteins, and carbohydrates so nutrients can be absorbed effectively. When a tumor forms in or around the pancreas, it may hinder enzyme secretion or obstruct the pancreatic duct, setting off a chain of digestive complications that range from uncomfortable to alarming. As digestive efficiency declines, food may sit undigested in the stomach, triggering symptoms like ongoing nausea, vomiting, abdominal bloating, and a general feeling of gastrointestinal discomfort. Over time, this impaired function can lead to a reduced appetite, since the body is no longer processing nutrients properly. The result is often unintentional weight loss, weakened muscles, and signs of malnutrition, further compromising the body's strength and ability to fight illness. One especially noticeable clue is a change in stool characteristics. When fat absorption is impaired, bowel movements may become light in color, oily or greasy in texture, and emit a particularly strong odor. Though this may seem like a minor issue, it's actually a critical warning sign that should not be ignored. These aren't just typical digestive complaints, they're signals that something more serious may be happening beneath the surface. Spotting these kinds of changes early on and understanding how they relate to pancreatic function can open a vital window for earlier diagnosis and potentially more effective treatment. If you found this information helpful, drop a 1 in the comments to let us know you're watching and learning. 2. Persistent fatigue and physical weakness. The exhaustion caused by pancreatic cancer is far more severe than ordinary tiredness. It's a constant, draining fatigue that doesn't go away with rest. Unlike feeling worn out after a long day or a night of poor sleep, this type of fatigue is deep-rooted and unrelenting. Even after several hours of uninterrupted rest, you might wake up feeling just as depleted as when you went to bed. Internally, the cancerous cells compete aggressively with healthy tissues for energy and nutrients, slowly depleting the body's resources. Everyday tasks, like walking short distances, climbing stairs, or carrying light bags, can suddenly become overwhelming. What was once routine starts to feel exhausting, turning daily living into a struggle. This loss of strength often goes hand in hand with emotional symptoms. People may experience heightened feelings of worry, sadness, or emotional fatigue as their physical energy continues to decline. On top of that, sleep patterns frequently become disrupted, making the tiredness even worse and creating a cycle of physical and mental strain. What makes this type of fatigue particularly concerning is how easily it's misattributed to common issues like aging, stress, or burnout. But unlike normal tiredness, this kind doesn't improve with rest. It gradually intensifies over time. Recognizing this kind of chronic, unexplained fatigue early can be a crucial step toward getting checked, as it may be one of the few early indicators of pancreatic cancer. 3. Recurrent fever and chills. Fluctuating body temperature, marked by bouts of fever and shivering, can be an overlooked sign of pancreatic cancer. These symptoms are often the result of inflammation triggered by the disease, which activates your immune system's natural response. When the pancreas becomes inflamed, your body reacts much like it would to an infection, but with some important differences. Unlike the steady, predictable fever typically seen with colds or the flu, pancreatic cancer may cause episodes of feeling extremely cold and shivery, followed by sudden spikes in temperature. These irregular fevers tend to come and go unpredictably, making them more difficult to trace back to a clear source. This irregular temperature pattern is often made worse when jaundice, caused by a blocked bile duct, occurs alongside pancreatic inflammation. Together, these conditions place the body under significant stress, leading to persistent internal conflict as it attempts to manage multiple complications at once. During these episodes, people frequently report night sweats and a general sense of malaise. Unlike fevers from common infections that usually resolve within several days, these temperature fluctuations tend to linger or reappear over time. Recognizing this recurring cycle of fever and chills, especially when no obvious infection is present, can serve as an important early clue in identifying an underlying issue like pancreatic cancer. 4. Blood clots. A frequently overlooked yet serious complication of pancreatic cancer is its strong impact on the body's blood clotting system. While most people associate cancer with tumors, pain, or weight loss, few are aware that pancreatic cancer can significantly increase the risk of developing blood clots, often without any immediate warning. This condition, known as hypercoagulability, makes the blood abnormally prone to clotting, especially in the deep veins of the legs. One of the most common manifestations of this is deep vein thrombosis, DVT. It typically presents as unexplained swelling in one leg, a feeling of warmth in the area, tenderness to the touch, and skin discoloration that may appear red or bluish. Though these symptoms might initially seem mild or harmless, they can signal a much more dangerous condition. If part of the clot detaches and moves to the lungs, it can result in a pulmonary embolism, a medical emergency that can become fatal within minutes. What makes this situation even more concerning is the biological mechanism behind it. Pancreatic tumors often release substances that trigger widespread inflammation, which disrupts the body's normal clotting function. This imbalance leads to a high-risk environment where blood clots can silently form with little to no warning. If a clot does travel to the lungs, the symptoms of a pulmonary embolism are usually very sudden and severe. Difficulty breathing, sharp chest pain that worsens when inhaling, and an accelerated or irregular heartbeat. These signs must be treated as urgent. Seeking immediate medical help is crucial, as early intervention can mean the difference between survival and tragedy. Understanding how pancreatic cancer contributes to clot formation helps individuals stay alert to potential red flags. Being aware that symptoms like leg swelling or unexplained shortness of breath could be linked to something far more dangerous can empower patients and caregivers to act quickly and potentially save a life. 5. Swelling of the gallbladder or liver. As pancreatic cancer progresses, it can trigger a chain reaction in surrounding organs, most notably the gallbladder and liver. These changes stem primarily from the tumor's tendency to block the bile duct, which serves as a critical passageway for bile to travel from the liver into the small intestine. When this duct becomes obstructed, bile begins to accumulate, leading to visible swelling in the gallbladder. Normally the size of a small pear, the gallbladder can become significantly enlarged as it continues to store bile without being able to release it efficiently. This backup results in noticeable distension over time. The liver, too, is affected by this bile flow disruption. As bile builds up within the liver, the organ may swell, sometimes enough to be detected during a physical exam. This swelling can present as a firm, enlarged area just beneath the right side of the rib cage. Advanced imaging tools like ultrasound or CT scans are often used to confirm these internal changes with precision. The close relationship between the pancreas, gallbladder, and liver means that dysfunction in one area can quickly impact the others. This interconnectedness often forms part of the diagnostic clues that help doctors identify underlying pancreatic disease. Physicians are trained to monitor for these specific organ changes during clinical evaluations, as they can serve as early warning signs of something more serious, like pancreatic cancer. Recognizing the ripple effect that a pancreatic tumor can cause across nearby systems is crucial in piecing together a timely and accurate diagnosis. 6. Gas and bloating. Pancreatic cancer can subtly interfere with your digestive system, creating discomfort that many people initially overlook. Since the pancreas is responsible for producing essential enzymes that break down fats, proteins, and carbohydrates, any disruption to its function can impact digestion in noticeable ways. When a tumor forms in or around this organ, it may impair enzyme production and lead to ongoing bloating and an unusual sense of fullness. One of the earliest red flags is early satiety, feeling full after just a small amount of food. This occurs because the tumor can press on nearby organs, such as the stomach or small intestine, reducing available space and interfering with normal digestion. Meals that were once easy to digest may suddenly leave you feeling overstuffed, bloated, or mildly nauseous. Unlike the temporary bloating caused by overeating or gas, this type of abdominal swelling tends to linger. It often doesn't respond to typical remedies like antacids, probiotics, or changes in diet. The abdomen may feel distended, even when you haven't eaten, and the sensation can persist throughout the day, growing increasingly uncomfortable. What makes this symptom especially worrisome is how often it's misattributed to stress, aging, or mild digestive issues. Because the changes come on slowly and don't always feel severe, many people delay seeking medical advice. But when abdominal tightness, bloating, or fullness continue for weeks without a clear cause, it may be a sign of something more serious. Being aware of these ongoing digestive shifts can make a critical difference. Identifying them early can open the door to earlier diagnosis and potentially more effective treatment for a disease that is too often caught in its later stages. 7. Abdominal or back pain. Pain associated with pancreatic cancer can be a key indicator of where the tumor is located, especially when it arises in the body or tail of the pancreas. This type of discomfort is often very specific and difficult to ignore. Many individuals report a deep, nagging pain that begins in the upper abdomen and radiates toward the back, often wrapping around the torso like a tight band. Unlike ordinary stomach pain, this ache is usually persistent and tends to intensify after eating or while lying down. The pancreas is situated near a network of nerves and organs, so as a tumor expands, it may begin pressing on nearby tissues, generating noticeable pain signals. Some describe the sensation as a dull, gnawing pressure, while others liken it to a heavy, unrelenting weight in the abdomen. What makes this pain pattern important is its progression. In the early stages, the discomfort might come and go, providing brief moments of relief. But as the cancer advances, the pain usually becomes more constant and severe. Paying close attention to the location, intensity, and timing of this kind of pain can help medical professionals distinguish pancreatic cancer from other gastrointestinal or muscular issues. This insight is especially valuable during diagnosis, as the characteristics of the discomfort often provide essential clues about what's happening inside the body. 8. Dark yellow or brown urine. The color of your urine can offer important insights into what's happening inside your body. When pancreatic cancer develops, it often leads to blockages in the bile duct, which can trigger a condition known as jaundice. This occurs when bilirubin, a yellow pigment created during the natural breakdown of red blood cells, begins to build up in the body. Under normal circumstances, bilirubin is processed by the liver and excreted through stool, giving it its typical brown appearance. However, if a tumor obstructs the bile duct, this pathway is disrupted. As a result, the body attempts to remove excess bilirubin through other means, including urine. Even when you're well hydrated, your urine may turn an unusually dark yellow, amber, or brown, resembling the color of cola or dark tea. This change is often one of the earliest physical signs of bile flow disruption. Unfortunately, many people dismiss it as a sign of dehydration, dietary changes, or temporary illness. But if this darker shade persists for more than a few days despite proper fluid intake, it should be taken seriously and evaluated by a doctor. Notably, this urinary discoloration can appear before more obvious signs of jaundice, such as yellowing of the eyes or skin. Catching this symptom early may provide a crucial window for early detection, something especially valuable in a disease that is notoriously difficult to diagnose in its initial stages. Pancreatic cancer is often silent in its early phase, but its effects are not. What makes it so lethal is not only its aggressiveness, but also how easily its warning signs are dismissed as common digestive issues, fatigue, or minor bodily changes. But as we've explored, these signs are anything but ordinary. They are subtle but significant signals that something serious may be unfolding beneath the surface. By paying attention to symptoms like dark urine, constant fatigue, abdominal swelling, or ongoing back pain, you may give yourself or someone you care about something incredibly valuable: time. Time to investigate. Time to seek treatment. Time to act before it's too late. The reality is this: awareness saves lives, and by sharing this information, you can help protect even more people. If this video gave you something valuable, don't forget to subscribe HealthBee channel, turn on notifications, and support us in sharing life-saving health content. Drop a yes in the comments if it helped you, or a no if it didn't. We're here to listen, learn, and make each video better for you.